Welcome, medical students, to today's lecture on Wilson's disease. In this comprehensive script, we will delve into the intricate details surrounding the etiology, pathophysiology, clinical manifestations, diagnostic criteria, imaging modalities, treatment options, and long-term complications associated with Wilson's disease. This hereditary disorder, characterized by impaired copper metabolism, warrants a thorough understanding, as it can affect various organs, including the liver and the central nervous system. So, without further ado, let us embark on this journey of exploration. Wilson's disease is a genetic condition caused by changes in a specific gene, called ATP7B, on chromosome 13. This gene provides instructions for making a protein called ATP7B, which helps remove excess copper from the body. However, in people with Wilson's disease, the ATP7B protein doesn't work properly, resulting in copper buildup in the liver and brain. This copper buildup can lead to liver damage and neurological problems. Wilson's disease is inherited in an autosomal recessive manner, meaning that both parents must pass on the faulty gene for the disease to develop. ATP7B, normally expressed in hepatocytes and other tissues, plays a crucial role in copper homeostasis by facilitating the transport of copper ions across cellular compartments. It regulates copper levels by incorporating copper into ceruloplasmin and excreting it into bile. Dysfunctional ATP7B impairs copper transport, resulting in its accumulation within hepatocytes and subsequent release into the bloodstream. The liver is the primary site of copper storage in Wilson's disease. Copper buildup leads to the formation of toxic free radicals, resulting in hepatocellular injury. Morphologically, hepatic specimens from affected individuals exhibit features such as steatosis, ballooning degeneration, and Mallory-Dank bodies. Ultimately, chronic copper toxicity can progress to fibrosis and cirrhosis. Wilson's disease is passed down through families in an autosomal recessive manner, which means that 2 copies of the mutated ATP7B gene are needed for the disease to develop. The ATP7B gene has more than 500 different variants that have been identified, and the specific variations can affect the severity of the disease and when it starts to show symptoms. It's important to note that both parents must carry a copy of the mutated gene for a child to inherit the disease. The clinical presentation of Wilson's disease is heterogeneous, ranging from asymptomatic to severe multi-organ involvement. Hepatic symptoms may include hepatomegaly, jaundice, coagulopathy, or even fulminant liver failure. Neurological manifestations commonly involve movement disorders, such as tremors, dystonia, and dysarthria. Diagnostic criteria, including clinical, biochemical, and genetic parameters, aid in establishing an accurate diagnosis. Serum ceruloplasmin levels, a biomarker for Wilson's disease, are consistently decreased in this condition. This occurs because of impaired incorporation of copper into ceruloplasmin, a hepatic acute phase protein. However, it is important to note that decreased ceruloplasmin levels can also be found in other conditions, indicating the significance of using multiple diagnostic methods to accurately diagnose Wilson's disease. These hyperintense signal alterations can help identify copper accumulation, which is a key diagnostic feature of Wilson's disease. CT imaging can also aid in detecting copper deposition, particularly in the liver, where it can show hepatic copper overload. By utilizing these imaging techniques, clinicians can non-invasively visualize and quantify copper accumulation in affected patients, helping to confirm the diagnosis and track the progression of the disease. These imaging findings, along with clinical history and laboratory tests, are essential for accurate diagnosis and management of Wilson's disease. A liver biopsy is a crucial procedure in the diagnosis of Wilson's disease. It helps assess the accumulation of copper and the resulting damage in the liver. By using staining techniques such as rhodonine or rubianic acid, we can detect increased copper levels in the liver. This method is considered highly reliable and is widely accepted as the gold standard for confirming the diagnosis. The information obtained from the liver biopsy aids in determining the appropriate treatment plan for patients with Wilson's disease. When it comes to treating Wilson's disease, various medications and approaches can be employed. Copper chelation agents, such as D-penicillamine, trientine, and zinc salts, are commonly used. These medications work by increasing the excretion of copper in the urine, which in turn helps prevent further damage to the organs. In cases where the liver disease has progressed significantly or when symptoms are not responding well to medication, liver transplantation is considered. This surgical procedure can provide a permanent solution to the disease, effectively addressing both liver and neurological symptoms associated with Wilson's disease. Neurologic involvement in Wilson's disease arises due to copper deposition within the basal ganglia and other brain regions. Movement disorders, cognitive impairment, psychiatric features, and even potentially life-threatening neurological crises like acute dystonia or Wilsonian crisis, can manifest. Early recognition and prompt treatment of neurological symptoms are crucial in preventing irreversible damage. Wilson's disease is a medical condition that commonly affects psychiatric well-being. Individuals with this condition may experience a variety of psychological symptoms, including alterations in their personality, feelings of sadness or hopelessness, depression, excessive worrying, anxiety, and in some cases, severe mental disorders like psychosis or an increased risk of suicide. Interestingly, these psychiatric symptoms can occur before any signs related to liver or neurological dysfunction, making them an important indicator for diagnosing Wilson's disease. If left untreated, Wilson's disease can have serious consequences for both the liver and the central nervous system. Over time, the liver can sustain chronic damage, ultimately leading to cirrhosis, hepatocellular carcinoma, or even complete liver failure. Additionally, the central nervous system can be severely affected by this condition, resulting in debilitating movement disorders and irreversible cognitive impairment. These complications greatly impact the patient's overall well-being and their ability to lead a normal life. Therefore, it is crucial for timely intervention and treatment to prevent these long-term complications of Wilson's disease. In conclusion, Wilson's disease poses unique challenges, requiring a comprehensive understanding of its underlying mechanisms, diagnostic approaches, and treatment options. The complexities associated with this disorder underscore the importance of multidisciplinary care involving hepatologists, neurologists, geneticists, and psychiatrists. Through early detection, appropriate management, and long-term follow-up, the prognosis for Wilson's disease can be significantly improved. As future healthcare professionals, I encourage you to embrace this knowledge and strive for excellence in Wilson's disease management. Thank you for your attention, and I wish you success in your medical career.